Hello everybody and welcome to IMV Imaging's Journal Club. My name's Amy, I'm one of the clinical team and I'm going to be talking you through a critical appraisal of the use of Doppler ultrasonography in very early pregnancy diagnosis in cattle. Specifically, the questions that I'm going to examine are: how early can Doppler ultrasound be used to accurately diagnose pregnancy in beef and dairy cattle worldwide? And second of all, a discussion of whether these techniques are relevant to the general practitioner. Images at the top of the screen there. On the left, we have a day 32 embryo recorded via standard B-mode ultrasonography. The center picture shows a corpus luteum and its vascularization as delineated by color flow Doppler. And on the right-hand side, we have a corpus luteum with its blood flow shown via power flow Doppler. A slightly different appearance there. So, a history of PDs for you. Manual PDs have been done for over 100 years. They can be done down to day 35 for experienced vets using the fetal membrane slip technique. B-mode ultrasonography has been available since the 1980s for PDs, and it's really revolutionized fertility work in cattle. An embryonic heartbeat is detectable at day 20 via B-mode ultrasonography. However, performing this technique before day 26 to 28 is both time-consuming and of limited accuracy. B-mode ultrasonography only reaches 100% sensitivity and specificity at day 26 in heifers and day 29 in cows. Note that in dairy cows, the specificity maximum is 96.6%. The standard on-farm early PD, the first time you're scanning for a pregnancy in a cow, is done around about day 28 to 30. And on the right-hand side here, you can see a day 30 PD done via standard B-mode ultrasonography with a conceptus filling approximately 10 millimeters of the screen there. Doppler ultrasonography of the corpus luteum has actually been studied since around about the year 2000. So why specifically are we looking at the vascularization of the corpus luteum? To answer that question, we're going to need to have a quick revision of the bovine estrus cycle. So the purpose of the corpus luteum is to release progesterone, also known as P4, and to support pregnancy until the maternal recognition of pregnancy occurs at around about day 15 to 17 after insemination. Plasma P4 is the gold standard measurement to indicate a functional corpus luteum, i.e. a corpus luteum that is producing over 1 nanogram per milliliter of progesterone. If the animal is not pregnant or there is a failure of maternal recognition of pregnancy, the corpus luteum will undergo luteolysis and regress from day 17 to 18, as shown in the diagram. The prostaglandin is released in a pulsatile nature, shown there in red, from about day 15 and a half by the empty uterus. There's no fetus in there, or recognition of pregnancy doesn't occur. The prostaglandin causes luteolysis and regression of the corpus luteum, so progesterone, shown there in dark blue, will drop, allowing estrogen, shown in purple, to rise, and therefore ovulation of the dominant follicle will occur. The estrous cycle begins again. So, if you are doing a pregnancy diagnosis scan and there's no corpus luteum at PD, clearly that animal is not pregnant. However, if you are doing a pregnancy diagnosis scan and you identify a small or what could be a regressing corpus luteum, what is the significance of this finding? There is actually a lag between the functional regression, i.e. reduced progesterone and blood flow to the gland, and the structural regression, i.e. size of the corpus luteum. So there is potential for Doppler ultrasonography to be used to actually visualize the reduced blood flow, i.e. function, earlier then you would see physical regression. And from this, you may be able to tell that luteolysis has occurred and therefore an animal specifically is not pregnant. There's just a graphic to demonstrate when luteolysis is occurring around about day 17 to 18. So on to our first study. This is a study from from America, looking at the evaluation of corpus luteum blood flow using colour flow Doppler ultrasound for early pregnancy diagnosis in bovine embryo recipients. Aims of the study were to examine the corpus luteum blood flow, the corpus luteum volume, and the progesterone levels after embryo transfer. And this is a pattern that is repeated across most of these studies. Secondly, to examine the accuracy of a pregnancy diagnosis made via colour flow Doppler ultrasound on days 17 to 21 specifically by 6 examiners of varying experience levels, which is where this study is interesting and translates to general practice because we have 6 examiners with varying experience. Keeps it relevant. So there are 50 beef cows aged 2 to 5 with no comment on pregnancies or lactation status, synchronized for embryo transfer using hormones that we have available in the UK that we use commonly for synchronization. Estrus was at day 0, embryo transfer occurred at day 7 when there would have been a functional corpus luteum to support the pregnancy. Corpus luteum blood flow and volume and progesterone were measured across the estrus cycle as shown. Video clips and frozen images were stored for the human analysis and software analysis, which is where pixel counts and equations are used to calculate the volume and the area of the corpus luteum, and the pixel counts are used to quantify the colour signals across the corpus luteum. A confirmatory PD is done via B mode on days 26, 33 and 40, and the data were grouped into 3 categories according to the day that each cow's progesterone may or may not have fallen below the cutoff of 1 nanogram per milliliter into pregnant cows, early embryo loss cows occurring at day 17 to 21, and then the later embryo loss cows, day 26 to 40. The late embryo loss cows also were diagnosed via B mode. So, picking one of the most interesting graphs from this study, I'll just talk you through it. On the y-axis, we have corpus luteum blood flow, which has been represented via colour pixels, calculated via software. On the x-axis, we have days after estrus. And what you can see is that at day 17, the cows, represented by the hatched bars, second along from the left, that lost their embryo at day 17 have a significantly lower corpus luteum blood flow. The other cows do not. So, day 19 after estrus, we have now joining the ranks of having lower blood flow are the day 19 embryo loss cows, which have significantly lower blood flow than the remaining cows. Day 21, we also have the day 21 embryo loss cows joining the cohorts of having significantly less corpus luteum blood flow. So in effect, what this shows is that corpus luteum blood flow is significantly reduced in cows that are not pregnant at the stage. A quick note on the value of experience of the evaluators. So you can see here that we've got percentage of correct pregnancy diagnoses using the corpus luteum blood flow by the examiner and the experience the examiner has. So we've got 2 advanced ones, 2 intermediate ones, and 2 novice ones. What's quite interesting is that the only statistically significant finding across experience was that evaluator E was less likely to make a correct pregnancy diagnosis than the other evaluators. This was not the same for a non-pregnancy diagnosis. Equally, if you look at the means on the right-hand side, the standard error of measurement across the evaluators is not very big, suggesting that the range of measurements, the range of correct estimations of pregnant or not pregnant, were not particularly big. Just to quickly present the sensitivity and specificity data for this study at day 17 to 21. There is an increase in sensitivity and specificity from day 17 to 19, but not from day 19 to 21. The main take-home message from this table is that the sensitivity and the specificity of the early PDs done at day 17, 19, and 21 are not particularly high, and certainly not high enough to hang your hat on as a diagnosis. So conclusions from this study are that the corpus luteum blood flow detected using colour flow Doppler ultrasound can be used to identify non-pregnant animals based on the decrease in corpus luteum blood flow, which is associated with luteolysis. Due to low specificity and sensitivity, evaluation of the corpus luteum blood flow alone is insufficient for early pregnancy diagnosis. The accuracy of the non-pregnant diagnosis was not dependent on ultrasound experience of the operator, which implies that less learning time may be required for this method, which is interesting for general practice. Limitations of this study are that there's no comment about how long the actual Doppler exam took the examiner, no description of the criteria which the examiners used to decide whether a cow was pregnant or not pregnant. So the relevance for novice learners in general practice can't really be commented upon. So the next study, this one does come from Germany. The examined luteal blood flow across the first 3 weeks of pregnancy in lactating dairy cows this time. So study aim were characterizing corpus luteum blood flow in pregnant and non-pregnant cows and determining its value for an early PD. This study took 54 lactating dairy cows, quite well aged match, quite well parity matched, over 6 weeks postpartum, but no comment on their milk production matching. 40 cows were artificially inseminated after estrus, 14 were not bred because they didn't show signs of being in heat. All cows had the variables measured, this time with power flow Doppler on the listed days during the estrus cycle. In this study, software was used to analyze the corpus luteum blood flow via pixel count. And at day 25, a B-mode PD was done, standard ultrasonography, to categorize the cows into 4 categories: not bred, not pregnant, embryo loss, i.e. estrus interval greater than 25 days, and pregnant. So, a small snapshot of the results here. On the x-axis, we have days after estrus, going up to day 18. Note that day 21's results were not reported. And on the left-hand side, we have progesterone concentrations, which I just wanted to highlight because it's a pattern that appears across all of the studies. The progesterone is very nicely linked with corpus luteum blood flow. And on the left, we have corpus luteum blood flow, top image here. So the corpus luteum blood flow declined precipitously in the not pregnant and the not bred cows after day 15. The not bred cows are represented by the bottom line there at day 18. In cows with embryo loss, interestingly, the corpus luteum blood flow was actually numerically less, albeit not significantly, than in the pregnant cows on both days 15 and 18, which does actually raise the possibility that we could use Doppler ultrasonography to predict embryo loss to potentially examine a non-healthy corpus luteum and an unstable pregnancy. From day 15, high progesterone concentrations in pregnant and embryo loss cows were associated with greater corpus luteum blood flow, which we expect. And that shows that the corpus luteum blood flow and progesterone concentrations are very highly correlated. There is, however, considerable variation among cows, which resulted in large ranges with substantial overlap. Conclusions from this study. There was no definable cutoff corpus luteum blood flow value that reliably distinguished between pregnant and non-pregnant cows on days 15 and 18 when the statistically significant differences appeared. Power flow Doppler ultrasonography is a useful technique for evaluating luteal function, that is, correlates strongly with P4 levels. Although corpus luteum blood flow was greater in pregnant than in non-pregnant cows, it is not a reliable method of pregnancy diagnosis in the individual cow due to substantial variation among cows. Limitations ultrasonographically with this study. Interestingly, the day 21 data, although recorded, was not presented. As you'll see in the following studies still coming up, the day 21 data is where things start to look more promising. These particular cows were not synchronized at all, so it relied on estrus detection, but moreover, the lack of synchronization hormones, how much of an effect does that have on the appearance of ovarian tissue? We don't know. Days 15 to 18, which is where the statistically significant differences occurred in these cows between pregnant and non-pregnant. These days are around the timing of natural luteolysis, and it has been shown that corpus luteum blood flow actually increases during this time transiently anyway in not pregnant animals. So the corpus luteum blood flow may have been a little bit higher, days 15 to 18, than later on in the estrus cycle, say day 20 to 21. So what's disappointing about this study is that no sensitivity and specificity and predictive values were presented. And in my opinion, the day 25 confirmation reference PD via B-mode ultrasonography seems a little bit early. So this is a really cool study because it makes it as relatable and practicable in general practice as possible. So this comes from Brazil, and it's looking at color Doppler flow imaging for the early detection of non-pregnant cattle at 20 days after timed AI. Note 20 days, moving later than the previous study, and we're now mentioning that it is non-pregnant cattle that we are wanting to identify. So, aims of the study: to determine the accuracy of a visual assessment of corpus luteum blood flow for predicting non-pregnant dairy cattle at day 20. Lots of cows in this study, 209 mostly Holstein dairy heifers, quite closely age-matched, plus 317 lactating cows, multiparous, all older than 3 years, fairly well matched for milk production, were synchronized for 5 rounds of timed AI using progesterone, estrogen, prostaglandin, and further estrogen. Note, we cannot use estrogen in Europe. At day 20, estrus was day 0. All animals had color flow, Doppler ultrasonography of the ovaries performed only. Note that the uterus was not scanned. This was to make this assessment as rapid as possible. Now, what's really good about this study is that classifications were made based on a single visual cow-side subjective assessment only of the corpus luteum blood flow, and animals were classified as pregnant or not pregnant. So, at day 30 to 35, as is standard in these studies, a reference B-mode PD was made again by the same blinded evaluator. A second evaluator also classified all of the day 20 videos as pregnant or not pregnant using 7-second video clips. The final B-mode PD, the confirmatory one, was compared with the 20-day color flow PD to gain your sensitivity, specificity, and predictive values. As is standard in these studies, 171 animals also had their plasma progesterone recorded at day 20 as well. So, the examiners were asked to categorize cattle based on whether they were pregnant or not pregnant, looking at the color flow of the corpus luteum. So, on the left, you have picture A, which is a corpus luteum with color flow signals across its surface in a pregnant cow. Image D is a corpus luteum with no or very few color flow signals across its surface, and that cow was not pregnant. So a positive pregnancy diagnosis, the examiners were asked to look for the presence of color flow signal with colored pixels within the corpus luteum that covered most of the edges of the structure and penetrated the luteal tissue towards the center, demonstrating intense blood supply throughout the tissue. A negative PD was no colored pixels on the corpus luteum, and the presence of only a few coloured pixels in small parts of the gland, primarily on the edges, demonstrating a lack of blood supply into the actual gland itself. And each corpus luteum blood flow examination was performed within 10 seconds after locating the corpus luteum using B mode. So quite a big table of results here, but what I wanted to highlight was the data in yellow, which is demonstrating the negative predictive values. The reason we're focusing on this is that Doppler ultrasonography is used to predict non-pregnancy. Now, as you can see, we've got some pretty convincing data. We've got evaluator 1 and evaluator 2, plasma progesterone reference test. And you can see that false negatives represented only 0.6 and 0.2% of the total diagnoses. The sensitivity, therefore, was very, very high, and the negative predictive value was very, very high. The plasma progesterone test recorded no false negatives and 100% sensitivity. So, a bit of a reality check with regards to decision making. You've already seen 2 of these pictures, but I've included 2 further ones. Cow A is a true positive, so she was truly pregnant and recorded as pregnant. Cow B was a false positive, decided she was pregnant and then was found not to be. Cow C is a false negative, so recorded as not pregnant, turned out that she was. That was very rare in this study, and cow D is a true negative. So can be difficult when you see all these pictures alongside each other. You do sort of wonder how easy it is to make the correct choice. A note on false positives, cow B, we're comparing a test done at day 20 with a test confirmed at day 30. And embryonic loss in cattle is pretty common. So between the PD at day 20 and the PD at day 30, there may have been embryonic loss. So there's every chance that cow B was pregnant on day 30 when day 20, when this picture was taken, but at day 30 she may well have lost it. So actually a lot of cattle end up being recorded as false positives in these sorts of studies. Conclusions drawn. There is reassuringly excellent agreement between the evaluators, as shown by the very high kappa value there of 0.91. There is also an excellent correlation with P4, which again confirms that corpus luteum blood flow correlates excellently with progesterone levels and therefore function of the gland. False negatives, which represented 0.6 for evaluators 1 and 0.2 for evaluator 2, respectively, only occurred in the first round of timed AI, which suggests a role of operator experience in making the correct diagnoses. In the remaining 4 rounds of scanning these cows after AI, no false negatives occurred. So that's quite reassuring for the general practitioner trying to learn this technique. The previous study which we looked at, Herzog et al. 2011, analysed the corpus luteum blood flow on days 15 and 18, whereas this study is doing it on day 20, when the differences between pregnant and non-pregnant animals are expected to be greater. Therefore, after luteolysis would have occurred in non-pregnant animals rather than during luteolysis. The limitations of this study are that I can't help but think that it could be too good to be true if you compare it with the sensitivity and specificities recorded in the previous studies. The colour flow Doppler ultrasound exam only took 10 seconds or less, but this was after finding the corpus luteum in the first place. And anybody who's done some cattle scanning will know that that's not always straightforward. Estrogens were used for synchronization in this study. Does this affect the appearance and vascularization of the corpus luteum? We don't know. So this study has a really good tagline, which is, how early can we detect pregnancy? I'm actually going to skip over the bulk of the methodology because quite a lot of it actually focuses on induced genes which are expressed when the conceptus is releasing interferon as part of maternal recognition of pregnancy. So the study was looking at whether the interferon-related genes can be used to detect early pregnancy. But what I want to do is actually look at the imaging side of things. So a similar picture to the previous study, and just to mention, this study also comes from Brazil, but is different authors and a different centre. So this study, luteolysis, therefore loss of the corpus luteum and a non-pregnancy diagnosis. Luteolysis was detected via the analysis of 3 still images of each corpus luteum. In order to decide that luteolysis had occurred, a corpus luteum needed to have a surface area less than 2 centimeters squared and corpus luteum blood flow signals that covered less than 25% of the luteal area. So looking at the picture, A to D are all pregnant cows. E to F are not pregnant cows. Casting our minds back to the previous study and the previous images, I think that analysis makes sense. Cows A to B have both got factors above the cutoff. So both of them have got an area greater than 2 centimeters squared. Both have got blood flow greater than 25% of the total area. Cow C has quite a small corpus luteum. The area is 1.78 centimeters squared, but has sufficient blood flow over 25. She was pregnant. Cow D, her corpus luteum is large enough via the cutoff, but the blood flow is too low. So if you were using only one of those criteria to decide pregnant or non-pregnant, you could get these incorrect. Conclusions drawn from this study were that the rapid colour flow Doppler ultrasonography method using corpus luteum area and blood flow was highly accurate for detecting non-pregnancy on day 20, as indicated by the 0% false negative results and the 100% sensitivity and negative predicted value, which implies a very minimal risk of misdiagnosing a pregnant cow as being non-pregnant. If we look at the data here, if we're only looking at luteal area, we had 1 false negative of 111, which is still less than 1%, so pretty good. We have 1 false negative out of 111 if we are only looking at luteal blood flow, which is what the previous study did. Again, that's pretty good. If we combine both measurements, we end up with 0 false negatives, 100% sensitivity, 100% negative predictive value. The limitations of this study in terms of ultrasonography were that the area of the corpus luteum was used and not volume. Some of the other studies have looked at both. So this assumes a 2D structure. So there's a confounding issue of planes of section achieved during ultrasonography. There's no discussion of how the pixels were actually analysed for graphic representation, and no description or discussion of who the examiners were who classified the animals as pregnant or not pregnant and their experience levels. So it makes it difficult to infer how this sort of technique would be used in practice. In the conclusion, it was referred to as a rapid method. However, the image analysis was not cow-side, and there was no discussion of how long the Doppler ultrasonography exams actually took. So, last study, putting it all together. This is fairly recent, it's from 2020 and it comes from Canada. So a fairly similar sort of system to what we have in the UK. And this is to examine the accuracy of corpus luteum colour flow Doppler ultrasonography to diagnose non-pregnancy in dairy cows on day 21 after insemination. So we're now at day 21. Excuse me, previous ones have been looking at sort of day 15, 18, 20, etc. So the aims of the study were to determine the accuracy of corpus luteum blood flow with colour flow Doppler ultrasonography to diagnose non-pregnant dairy cows 21 days after insemination, and to determine the accuracy of corpus luteum size and progesterone, similar to the other studies. Over 1,600 Holstein cows from 10 commercial herds were visited weekly for scanning, and timed AI was performed on farm after synchronization as needed, sort of as the herd went along in its day-to-day work. Cows were examined on day 21 after AI to examine the CL size, and then colour flow Doppler ultrasonography was used to score the blood flow as shown on the chart using a cow side chart. So this is a cow side test. As usual, a day 32 B mode reference PD was performed, and this time by the regular herd vet. Categorization of blood flow done cow side fell into categories D0 to D3 as shown. D0, we've got less than 10% of the corpus luteum area coloured by pixels. D1, 11 to 30%, D2, 31 to 60%, D3, 61% or more. In a subsample of 200 cows, a second vet, blinded to the first vet's results, also performed the same examinations. Results were compared to calculate inter-observer agreement, and there was a test of intra-observant agreement as well. So the same vets were shown their own scans a period of time later, blinded to the original results, and asked to make a diagnosis again. Now, what's unusual about this study is that they have presented the data as a measure of non-pregnancy rather than a measure of pregnancy, which is how the previous data had been presented. So in effect, the sensitivity and specificity of this study are the other way around. So the accuracy measures for diagnosing non-pregnancy using corpus colour flow Doppler ultrasonography were high, 99% specificity for the D0 only category, i.e. less than 10% of the corpus luteum vascularized, and 94.8% for the D0 plus D1 category, i.e. less than 30% of the corpus luteum vascularized. What you'll see as well in the sensitivity column is that if we are looking at the corpus luteum blood flow up to D2, which was less than 60%, it's actually very sensitive for non-pregnancy, i.e. it's a good pregnancy diagnosis. But the presenting the results as a measure of non-pregnancy takes a little while to get your head around. What you can also see here is that corpus luteum size is also very accurate, down at less than 15 millimeters, as shown by the high specificity of the non-pregnancy diagnosis. Other results of this test, inter and intra-observer agreement for rating the corpus luteum colour flow Doppler ultrasonography were 0.9 and 0.94, which is quite high on the kappa test. So that's really encouraging for learning this technique for general practice. Examinations took between 1 and 3 minutes per cow, again, very translatable to general practice. A small corpus luteum, less than 15 millimeters, is sometimes used to identify non-pregnant cows. The accuracy of this for diagnosing non-pregnancy in this study was 97.5%, although the prevalence of a corpus luteum this small was very low, so that limits the usefulness of this technique. So the take home from this study, the message was that in order to implement the use of this technique on farm, future studies need to investigate which rebreeding strategies will increase the subsequent reproductive performance off the back of having the knowledge of a negative PD at about day 2021. The limitations of this particular study: the farms were visited by a vet and tech from the university, and then there's a subsequent comment about inter and intra-observer agreement. Not sure how many examiners were actually involved in scanning the cattle to start with. And different farms used, there were 10, had different synchronization programs. And some of them actually didn't use any synchronization for repeat breeders, so presumably used a bull to mop up the repeat breeding cows. Although the farms were actually chosen on the basis of using synchronization. So it does make you wonder how much the use of exogenous hormones affects how the ovary will look when scanning it. So, is an earlier pregnancy diagnosis desirable? A little dip into synchronization programs here. Conventional synchronization programs will mean that you restart the same program, which takes about 10 days, after your negative PD is received at the standard PD date of day 30. So you end up doing a timed AI again 40 days after the first. So you end up with a 40-day interval between services. If we restart the synchronization in cows 12 to 14 days after the first timed AI in all cows, irrespective of whether they're pregnant or not, because you won't know at this stage, then you Doppler scan at day 20 to 22 and you get a negative PD, you are then able to deliver a second timed AI 22 to 24 days after the first, off the back of having pre-synchronized these cows in expectation of receiving a good proportion of negatives, because that's normally how things are with bovine fertility. This results in a 22 to 24 day interval between services, which potentially has financial gain to the farm. But hormonally manipulating the cycle to synchronize follicular waves before maternal recognition of pregnancy occurs would potentially have some poor consequences for pregnancy rate. And there are actually mixed reports of the effect on pregnancy rate of very early resynchronization before the first PD. So, how relevant is this technique for general practice? All the papers that I have presented, and others actually in background reading, used different cutoffs for corpus luteum blood flow analysis. So if you pick your cutoff, you're going to effectively manipulate how your data appears. Most papers use software to analyze the pixels retrospectively rather than cow side, not exactly translatable to general practice. The expense of synchronization and resynchronization programs in terms of vet visits, drug applications could mount up significantly. And there's the issue of licensing of estrogens in Europe. We can use GnRH to give a similar effect on the follicular waves, but it has been shown not to be quite as effective as estrogens. There is going to be a lot of time taken to learn this technique and a lot of time taken to perform the exam. There's a large range of how long the exam takes in the reports. All of the authors and the scanners, as far as I could ascertain, were very experienced cattle practitioners. Resynchronization options in Europe, GnRH is not as effective as previously mentioned. You'd need to use the information gained from an early negative PD to resynchronize these animals to make it financially viable and make it actually desirable on the farm. There is the question of the expense of Doppler imaging equipment. Doppler imaging equipment is more expensive than standard B mode. So there's the issue of practice investment, whether practices would want to get involved with this sort of technique. We do need some farmer engagement as well, and that is not necessarily a given, particularly if you are manipulating the cow's estrous cycle in the background of her being potentially pregnant. It could be quite risky, and mixed reports of success here. And generally, to be honest with you, although these papers examined the negative PD, so defining something as non-pregnant, the gold standard for pregnancy diagnosis is likely to always remain the detection of an embryo with a heartbeat. So, thank you for listening. I hope that's been useful to you, and hopefully we'll see you again at another Journal Club soon.